welcome to the Right PT Beard Show. We're happy to be here today.
It's us. We're here.
It's us. We're here. No, for real though, welcome to the hottest show on the interweb. We're very excited to be here, the Right Physical Therapy Show. I am Dr. Kate Anderson, Dr. Physical Therapy. This is Dr. Spencer Townsend, also Dr. Physical Therapy. This is a new face on Facebook Live today.
Yeah, I'm excited to be here.
Good to have a new face.
Yeah,
a good looking
changing
one too.
up it a little bit. You know what I'm saying? I'm just trying to follow his lead with the beard, though. You know what I mean? So
yes, absolutely. Well, it's awesome. So Spencer is the clinic director of our clinic on the corner of Falls and Locust here in Twin Falls. Does a great job with patients. People actually really like him.
Stop it.
So, a great therapist, a great guy to be around. So, we are excited to be here because we're going to be talking about. I almost fell over. Did you see that? On Facebook Live. Tripping over things. We're here actually today to talk about blood flow restriction. I don't know how many people have heard about blood flow restriction out there. Often known as BFR. A lot of people just say BFR for this. But we want to talk about BFR and how it was developed, what it was developed for, and how we can utilize it in rehab to enhance rehab. And so we're super excited to talk about this. This is something that has really come down the pipeline in the physical therapy world within the last few years. Absolutely. I would say this is becoming more and more popular, and it's been found to be highly effective in helping people that have injured tissue to be able to rehab and restore normal tissue health. And so we've seen great results from it in our clinics, and we want to make sure that we can educate people about it. And so BFR blood flow restriction sounds kind of scary.
Yeah.
So maybe you've seen this before. You get straps, they're put on the leg. I think sometimes the perception is that you put it on, you pump it up until you don't get any blood flow, and then you work out with it. That's something I've heard is like the perception of it. That's not quite the case. There is some science behind it, so we want to kind of talk about that today. And so it was actually developed in Japan. It was called Katsu. I should have asked Cliff about this.
Excuse
you. Thank you very much. Katsu. Achu. I should talk to Cliff about how that was pronounced, but I believe that is.
Yeah,
Cliff
we should
have been able to tell me.
Yeah.
Katsu, and it was basically it was research about modifying blood flow during exercise. So we started doing some research on this, and they were talking about modifying blood flow, not completely occluding it, but modifying it. So seeing if they can just or basically decrease the amount of blood flow coming into a muscle as you're working it out, and what the effects of that would be. Some of the things they found is that they had greater strength and greater hypertrophy when they used blood flow restriction. So hypertrophy meaning that the muscle actually grew bigger, larger, right? Yeah. Like the muscle fibers actually grew larger and you became stronger from doing it. And so some of the earlier research has come out, and this has been continually proven over and over again, is that when you were doing about 2 to 3 days a week of low intensity BFR training, it was actually more effective. They got more strength gains and more hypertrophy than when people were doing 5 days of just regular strength training. So almost twice the effect, right?
Yeah.
Or the same amount of effect with less time, right? So obviously there's something to that the science says, hey, when there's blood flow restriction, you're actually able to have a greater effect on things. And we want to talk about that. Now, a lot of people use this for when you're trying to get big and strong. So it's used actually in bodybuilding and different things that way a lot. But what we have found it to be highly effective is in rehab. And so in rehab, you have injured tissue. So when you come into physical therapy, you have injured tissue and you're trying to improve the health of that tissue. Now the issue with that is that 95% of the time, what is needed in order to improve tissue health and get people back to doing what they love, the thing that is needed is to load the tissue.
Right.
And so you have to increase the load of the tissue, you have to be able to get stronger, you have to be able to do those things if you want to get back. But the issue with that is that you have possibly tears there. You have actual mechanical stress at that muscle, and that's an issue. Because when you're working out, let's say we're going to do a bench press for a few minutes here, right? So if we're doing a bench press, what happens is there's breakdown of the muscle fibers on a cellular level, and what happens is that breakdown actually damages the muscle, and as the body comes in and repairs that, it repairs in a way that it's stronger and it's bigger. So you actually have a larger diameter on those muscle fibers, right? And that's how you get bigger and you get stronger. But the issue is that if it's already broken down, it sometimes can be hard to figure out how can we continue to put a mechanical stress on that so that it breaks it down even more while we're trying to load, right? It turns into a conundrum of sorts.
Absolutely.
Yeah, conundrum, right? And so BFR, the thing that's great about BFR is that when you actually put BFR, we're going to explain how this works, but if you do put a strap, let's say we're talking about a leg and we do put a strap, if we modify the blood flow into that, what it allows us to do is it allows us to actually have a much higher load on the muscle and on that system than we would be able to if we didn't have the BFR. So for example, let's say that you squatted 350 pounds. If you put BFR on and squatted 150 pounds, a lot of times it would have about the same effect as that 350 pounds would because of the hypoxic nature, which means the lack of oxygen from the blood flow that is occurring at that muscle. And so it's incredibly helpful because what you can get is, instead of a mechanical effect on the muscle, you get what's called a metabolic effect at the muscle, which is basically, there's a hypoxic atmosphere within this muscle right here. And because of that, the body, it's harder for the muscle to be able to do what it has to do, and it has to work harder in order to do that. And because of that, the body will actually stimulate growth hormone release on a local level and on a systemic level. So you actually get a growth hormone release in the body to counteract what's happening there. And so it's perfect for people that are injured because we can do that in a way that doesn't cause a mechanical load on a muscle, and do that through the use of BFR. What would you add?
Absolutely. Like I think that's key to know that it's almost like the body is being tricked into thinking that it's working harder than it actually is, which is awesome for our patients, for a wide variety of different patients. First and foremost, post-surgical patients that are coming in here after an ACL tear or whatever it may be. If we're trying to get their quad to be loaded in a way that's going to be strengthening it and providing those adaptations needed in order for that therapeutic response to happen, and they can't load it through their own volition, like blood flow restriction is going to be the way to load that appropriately without damaging that newly reconstructed ACL. You have a patient that comes in with significant osteoarthritis in their knee or their elbow. All of a sudden, we can start working those exercise or those muscles that cross those joints without putting the tremendous load that puts a lot of that the painful stimulus on those joints. And so there is a lot of good benefits to using that in the rehab process and also in the sports performance in general. And so why don't we look at that? Is that cool? Why don't we just check that out?
Let's absolutely look at it. This
Perfect.
is a good idea.
Let's do it.
Where would you like me, Spencer?
So Kate, come and just take a seat right here for me.
Got it.
I'm just going to have you lay down.
Lay down?
Yeah, that'd be great. So what we do typically is every patient's a little bit different. Like when you think about blood flow restriction, we got to look at it like really three different factors. First of all, the occlusion rate. When I say occlusion is just blocking that, like Kid was talking about, is blocking that muscle or the blood to that muscle. But we don't want to do it necessarily the same for everybody because everyone's going to have different responses to it. So we want to look at the occlusion rate, we want to look at the amount of volume that we're bringing to that exercise, and also the amount of load that we're doing with the exercise. So we can manipulate those three different factors in order to get the proper therapeutic response, okay? So what that will look like is we'll pull this BFR strap out. This is called an occlusion cuff. What I would do is first and foremost, I would just bring Cade's leg up just like this and put it around his leg on the upper side right here, okay? Pretty easy. All right, Cato.
Can you hold that for me?
Hold that for me, that'd be great. So as you see, it's kind of like a tourniquet, basically what I'm doing here. The thing is though, what we would do, and just for time's sake, I won't go through the whole process, but we have this Doppler that we use to test Cade. We'll measure Cade's arterial blood pressure, and we base that occlusion rate based off that pressure. So we'll look, if I were to cinch this as tight as I could, let's just say we get to his full LOP, meaning his limb occlusion pressure, meaning that there is no blood getting to the leg at all. That would be 100%. What I would want to do is dial that back through calculations that are typically around 70 to 80%, or even lower depending on the patient. Okay, and so what I would do is kind of like a blood pressure cuff. Honestly, I would set this up here. Have that, and I would go up like with whatever occlusion rate we have decided. I would start pumping this up to the point that we get to that occlusion rate. Let's just say we got to that occlusion rate right here. We're at about 60%. Is that feeling pretty tight for you, Cade?
No, it was okay.
Feels pretty right? Okay. So what I would do, let's just say, for example, now Cade, he's a runner. He's a big runner, just so you all know. He actually has a little bit of an injury himself right now. He's been dealing with some knee pain that we've been dealing with. And so in order for him to get back into running, we want to be able to load this tissue. It will load that tendon but because it's been so painful for him, we just haven't been able to load it appropriately. And so BFR is a good way to trick the mind into thinking that it is working so much more than it really is. So with this blood pressure cuff on, what we'll do is, Cade, let's have you come off the table for me. How's that feel, Cade?
Feels good.
That feeling all right?
Yep. Feels
All
like
right.
a little pressure in my leg, basically.
Perfect.
Yeah.
So, Cade, why don't we do this? Why don't we just have you do some single leg squats? So what I'm going to have you do is basically I'm going to have you just drop down onto one leg, coming down like this, and then with two legs, come up. We're just going to go back down and up like this. I just want to get a sense for how that feels.
We're going to be down.
And come back up. Perfect. Cade, how's that feeling?
Feels good. Feels hard.
Does that feel a little difficult to you?
It does. Mm-hmm.
Okay, so that's the thing with this with this BFR. That exercise typically, he's like that. If he were to do that without the cuff, he'd probably do that pretty easily. But with that, even after a few reps, he's starting to feel that muscle burn, that metabolic stress that Cade was talking about. Now, typically BFR has different protocols that we like to implement. Typically, it's about 30 reps or so, followed by about 4 or 5 reps of 15 with a particular exercise. But obviously, every patient is going to be different, so we'll load them appropriately depending on the load, the volume, and the occlusion rate.
Awesome. And this feels, it's pretty comfortable. You feel some extra pressure,
Yeah.
and you get tired more easily. You get very fatigued. You get this very fatigued feeling in the leg when you're doing certain things like this. But overall, it's very comfortable. And I've actually been to places where it's been pumped up tighter. Some trainings I've been to where they've gone and they've pumped it up quite a bit tighter. The science says you don't have to completely occlude things, right?
Yep.
So you don't have to necessarily pump things up to the point that it's painful and you're like really struggling, like I've seen with a lot of people. There is a comfortable way you can do this that's perfect for rehab.
And the key is the fatigue, right?
Absolutely.
If Cade was doing that and he got to that 10th, 15th rep, he's like, man, I'm killing it. You know what I mean? I'm doing great. Then I would pump that occlusion up or bring up or put a little bit more load onto that because we want that fatigue to happen so we get that appropriate load so it is a therapeutic response to that loading.
Yeah, more weight, more reps, like something to increase the load, right? So out of curiosity, what are some of the things that you feel like you've seen use this the most on?
Honestly, the biggest thing that I've seen, I've used it on, is my post-op patients that aren't able to activate or strengthen their quad appropriately, and also like lower extremity knee pain. Like I have seen that work substantially with my patients. But I know we did a little bit of demonstration on the lower extremity, but also at the elbow. Like for example, me personally, I always struggle with this elbow pain that's just driving me crazy. You know what I mean? And I've actually used a little bit of BFR because whenever I load it, whenever I try and do heavy weights with this, I'm not as heavy as this guy, but whenever I try and do heavy weights, I get that pain throughout the elbow. And so I have actually done BFR to lower that weight, but still get the same therapeutic response to that.
Yeah, exactly. So it can be done on the upper extremity as well. This is great for post-ops, meaning post-operative rehab that we have to do. We have to follow a protocol where we can't put too much stress on a healing tissue, but this is a way that we can still put a load on it without stressing the healing tissue too much. Still allows it to heal very well. So this is highly, highly, highly effective. If you had to kind of take away some main takeaway points from BFR, what would they be?
I would say first and foremost, I think we've been talking a lot about athletes. This is actually for our older populations as well. You know what I mean? Like this is definitely something that I have seen with some of our older populations that have aches and pains that just don't seem to go away. And every time they try and do stairs or whatever it may be, they're like, man, I just can't do this. Well, let's load it, but let's load it appropriately through this BFR. So I think takeaways is it can be used with a variety of different patients for a variety of different reasons, and we are able to load that tissue safely and appropriately in a way that it tricks the brain into thinking it's loading it much more than it really is.
Yes. And my takeaway would be this, that the key to rehab is that you have to load a tissue to the point that it adapts to the amount of stress you put on it in your day-to-day life, right?
Yeah.
So if you're a couch potato, you don't put a lot of stress on your tissue, right? But if you're hiking Bora, you're putting a little bit more stress, and so you have to be able to load the tissue until it can handle the stress of whatever it is you're doing from day to day. So if you're trying to increase your activity level, for example, like let's say you have been a couch potato, and now it's time to say, hey, I want to do the couch to 5K, or I want to get in shape, or whatever it is. Your tissue is probably not prepared to handle. It hasn't adapted yet to the increase in activity you're going to put on it, right? And so that's what rehab really is. It's trying to help the tissue to do that. So BFR, it is not like the be-all end-all solution to everything. Really, I mean, there's nothing. The be-all end-all solution to everything is loading on it. But this is something that can enhance our ability to do that really comfortably.
Yep.
So it's incredibly helpful in rehab, and we love this, and we have had tons of success with this. So if I had to sum up one last thing, I would say just like Pedro on Napoleon Dynamite, there's a lot more where this came from if you go to the dance with us.
Oh,
You know what I'm saying?
I'm going dancing,
You're
baby.
going dancing.
I'm going dancing.
And I think that's the key. You know, please, if you have any questions about the use of BFR, if you feel like that would help some of the ailments you are having, please contact any of our Right Physical Therapy locations scattered throughout Magic Valley, Boise, Eastern Idaho. Great clinicians every place you go that are well trained on BFR and the way that it can be used in rehab. Anything else you would add?
Perfect. I just appreciate it. Thank you so much, everybody.
Yeah, Right Physical Therapy Show. We are out.
Out.